Tonight, a story that demands your attention. An exclusive 5 on your side investigation into a widely used prescription drug, and there are new warnings about dangerous side effects.
Yeah, Chief Investigator Ron Regan joins us. And Ron, you found patients not being told about some serious risks.
That's right. We're talking about a family of drugs that are known collectively as fluoroquinolones. Now, you might know them as Levaquin or Cipro, powerful antibiotics. But despite being linked to death and other serious side effects, we found the FDA knows more than it's telling.
It ruined my eyes, really. I woke up, I took it for a couple days. By the third day when I woke up, I couldn't see.
Cindy Rapkin is describing what happened after taking this widely used antibiotic. Levaquin is prescribed for serious infections like pneumonia and kidney infections. So powerful, it's even used to prevent anthrax. But Cindy was being treated for a sinus infection, and her side effects worsened.
Beyond that, I was having such horrible joint pain. My knee was killing me. I was hobbling.
She finally stopped taking it, and we found she's far from alone. We obtained this FDA database of adverse effects for Levaquin and similar drugs. We found at least 3,000 reportedly died, and another 200,000 complaints related to Levaquin and other fluoroquinolones. Dr. Charles Bennett researches drug safety.
The FDA gets about 1% of all reports. So take 3,000, multiply it times 100, we're talking about 300,000 deaths. That's a lot.
In 2008, the FDA warned of an increased risk of ruptured tendons. It's called a black box warning, the FDA's most serious. In 2013, it expanded to include serious nerve damage. But we found there are other possible side effects the FDA is aware of, but remaining silent. We obtained this FDA report, and it raises alarming questions over possible mitochondrial toxicity. What's that mean?
Put in plain language, mitochondria, they're the gas tank. You have no mitochondria toxicity, means there's no gas in the tank, and the body really cannot function.
So, a full year ago, Bennett filed this petition with the FDA, urging that drug companies include an expanded warning.
And all we've asked for is very simple. Please put the information so doctors can find it and a black box warning in the back of the insert.
Instead, FDA wrote back, claiming it's been unable to reach a decision.
So the FDA report is exactly where our petition is. The same exact terminology, same exact words. All we're asking is for the FDA to include in the black box warning, to allow the company to put the black box warning, the FDA findings.
Nobody told us anything about the side effects.
Bob Paddock's wife was never warned. Her tendons and joints grew so painful, she relied on knee pads to help move along the floor.
The side effect of the Levaquin was that she could not walk. It attacked the tendons in her ankles. It also attacked her wrists. She ended up wearing wrist braces.
After years of struggling with pain, Karen Paddock committed suicide.
Her wrists hurt, her ankles hurt. It was just an accumulation of the various pains from that and her other health conditions that pushed her over the edge.
People's lives, people's livelihoods, and the economy are all at risk.
Well, the FDA said it will not discuss ongoing drug investigations, but it did say it takes concerns we raise seriously, and it is considering that citizen's petition we talked about in our report.
Actually, that was a high number of deaths related to this.
It is, and it's important to keep in mind that no one's asking for it to be taken off the market because it is effective, but the public needs to know more about the side effects.
Yeah, the side effects definitely make you grimace.
Thank you, Ron.
You bet.